Good afternoon, and thank you for joining us for today's session, Policy Applications Based on ACS Data. My name is Kirby. I am your moderator for today, and with me I have our panelists joining us, Julian Leiter, Kelly Dwyer, and Dory Thrasher. We're really excited for all of their presentations today, so we'll go ahead and just jump right in. Just a few housekeeping things before we get started. I think all of you are probably pros at this now throughout this conference, but in your attendee hub, please feel free to drop your questions in the Q&A, and we will go ahead and sort of hold all those questions until the end of the session, and then we'll have a chance to interact with each of our presenters. So please feel free to dialogue there, also use the chat function, and please also make note for your questions of who your question is for. So if you can just put in parentheses the presenter that you would like me to direct that question to, that's helpful as well. So without further ado, let's go ahead and get started. And I'd like to welcome Julian Leiter from the Institute for Health Research and Policy from the University of Illinois, Chicago. And he will be taking us through his work today on zoning and complete streets policies and active travel to work. So Julian, thank you for joining us.
Thank you very much. Let me just share this. And Kirby, can you confirm that this is coming through?
Looks perfect.
Great, thank you so much. So yes, I'll be presenting analyses that we conducted looking at the association between zoning and complete streets policies and active travel to work, both of which relied on ACS data for our outcome measures. My co-author for this presentation is Jamie Shrieky, and we thank our previous and current funders listed on this slide. I'll begin with a brief overview of both of these types of policies, present our results, summarize key findings, and close with our key lessons learned in using the ACS data for conducting these types of analyses. To motivate this, in 2018, only 24% of adults in the US met the 2008 physical activity guidelines. And that was only 54% even when looking just at the aerobic activity guidelines. Active commuting to work by walking or biking can play an important role in helping adults be more active. And that's also true of public transit, because public transit users typically walk to and from stops or stations, and also walk within larger stations. Features of the built environment, such as street connectivity with more compact neighborhood designs where things are closer together and easier to get to, have been shown to be associated with more physical activity. And as a result, several authoritative bodies have recognized the importance of the built environment in this role. Zoning policies are one aspect of this, because zoning policies regulate land use as well as features of the built environment like sidewalks and bike lanes. So they can play an important role in making the built environment more activity friendly. Traditional Euclidean zoning doesn't tend to emphasize activity friendly features, and instead tends to rely on single use zones that typically contribute to more reliance on cars by making things more difficult to get to. However, recently zoning code reforms have gained popularity, in part because of movements such as smart growth, and these have included things like traditional neighborhood developments and form-based codes. Another important policy development has been the complete streets policy, which is designed to prioritize all users of a street. In particular, not just cars. And these have been adopted in many jurisdictions across the United States. Specific design elements vary by context, but can include things like sidewalks, bike lanes, bus lanes, and more convenient public transit stops. So these are two separate analyses, and I'll begin here looking at the relationship between zoning policies and active travel to work. This is part of a much larger study looking at zoning in the most populous 496 counties and 4 consolidated cities in the United States, which represented 76% of the US population in 2010. For this analysis, we looked specifically at municipal zoning, And we had to exclude a limited number of jurisdictions for which we either couldn't obtain zoning codes or in a small number of cases lacked data on covariates needed for analyses. The final sample included 3,914 municipal jurisdictions covering 45% of the US population in 48 states and DC. For the sample, we collected zoning codes as of 2010 and coded whether they addressed 10 items, including code reform zoning overall, so the types of reforms that I mentioned earlier, as well as 9 specific provisions, which are listed here and include things like sidewalks, bike lanes, and mixed use. Our active travel to work outcome came from the ACS 2010 to 14 5-year estimates. In particular, the ACS question asking about how individuals got to work last week. This included a number of response options, and of interest to us, it included options for walking, biking, or taking any of 5 specific public transit options. For this analysis, we computed measures of the percentage of workers who walked to work, biked to work, or took public transit to work, as well as an overall measure of the percentage of workers taking any of these modalities to work. We used linear regression models with robust clustered standard errors, controlling for ACS data on a number of ACS sociodemographic and socioeconomic characteristics listed here, as well as a walkability scale, which was designed to partially account for the built environment by measuring housing and population density, as well as intersection density. And that measure was based on ACS data combined with NAVTEC 2013 data. So I begin here with just the overall prevalence of these zoning measures. We had nearly 15% of jurisdictions in our sample had code reform zoning. The prevalence of specific provisions ranged from just over 10% for bike lanes to just under 78% for sidewalks. And we had majorities of jurisdictions addressing several other zoning measures shown on the right, including mixed use. Our first outcome here looks at the prevalence of workers walking to work. And we find that several zoning measures are positively associated with workers walking to work. And those are shown in bold and are the last 4 measures on the right on this slide. So for instance, without zoning addressing bike parking, we found an adjusted prevalence of 2.5% of workers walked to work. But with such zoning, 2.9% of workers did so. Similarly, for biking to work, we found a number of positive associations. And in fact, for this outcome, we found positive associations for all but 2 of the zoning measures we examined. For public transit use, we did not find any significant associations in the full sample, but we will return to this in a moment in terms of some stratified analyses we conducted. For our overall measure, we found a number of positive associations, including with code reform zoning, where we found that without code reform zoning, an adjusted prevalence of 6.1% of workers took any form of active transportation to work. But with code reform zoning, 7% did so. And we similarly found positive associations for bike lanes, bike parking, and other walkability, which was a catch-all term for items not captured elsewhere on our zoning form and included things like pedestrian plazas and traffic calming measures. Returning to our analysis of public transit to work, where we didn't find associations in the full sample, we did think it was important there to look at stratified analyses because notably public transit use is much lower in the South compared to other regions of the country. In these stratified analyses, we did find that several zoning measures were positively associated with public transit use in the South specifically, including code reform zoning and several specific provisions. We did not find any significant associations when looking at non-Southern jurisdictions specifically. Turning to our analysis of complete streets policies and taking public transit to work, this analysis was based on a compilation of all complete street policies in existence as of May 2015 in the United States. For the analysis, we looked at two frames. One included all counties and consolidated cities, and the other included all municipalities in the United States. And this was based on all geographies under the relevant summary levels from the 2010 to 14 ACS 5-year estimates. For both frames, we excluded jurisdictions without governmental authority. There was also some duplication where some jurisdictions could be considered under multiple types. And we deduplicated with reference to how the jurisdictions were classified in the 2012 Census of Governments. So the process of getting to this frame was very involved and also highlights some issues in working with the ACS data and some things to keep in mind. So I go into that in more detail here. So first, for our county and consolidated city sample shown on the left, we started with 3,142 counties and 8 consolidated cities in the 50 states and DC. We excluded 76 counties which were duplicate of either a place or a consolidated city so that we weren't double counting. And we also excluded 31 counties which lacked governing authority, including 11 county equivalents in Alaska, as well as all counties in Connecticut and Rhode Island, and most in Massachusetts. And in those states, that was because counties simply don't have governing authority. We treated 2 counties as municipalities based on how they were classified in the Census of Governments. For the municipal analysis, we started with 30,642 places within counties, and we excluded places without governing authority, which included nearly 10,000 census designated places, as well as 8 balances of county and 1 place which we knew to lack governing authority based on the information from the Census of Governments. For the municipal analysis, we also had to exclude 611 cases due to missing data on covariates or our outcome measure of taking public transit to work. Our final analytical samples included 3,041 county and consolidated city governments and 20,122 municipal governments. We used linear regression models for analyses, and with robust standard errors clustered on state or county based on the appropriate level, and controlling for jurisdiction characteristics as shown here. We also controlled for the presence of a higher level complete streets policy, which would be a state policy in the case of a county or consolidated city, or either a state, county, or consolidated city policy in the case of a municipality. We weighted all models by population size. The overall prevalence of these policies was 3.1% in municipalities and 2.2% in counties and consolidated cities. We found positive associations at both levels between having a complete streets policy and taking public transit to work. At the municipal level, without a municipal complete streets policy, 5.2% of workers took public transit to work. But with such a policy, 11.3% of workers took public transit to work. And similarly, for counties and consolidated cities, we found an adjusted prevalence of 2.5% of workers taking public transit to work without a policy, but 6.9% of workers taking public transit to work with a policy. So to summarize, for zoning, we found significant associations between zoning and active travel to work for all but 2 of our zoning measures. And we found positive associations at both levels of our analysis of complete streets policies. And these results highlight the potential importance of these policies for encouraging active travel to work. Although it is important to acknowledge some key limitations, including that the policy data are cross-sectional, so we can't establish causality. And we lack data on the presence of built environment features, such as sidewalks or bike lanes, corresponding to these policy measures. So we can't assess on-the-ground implementation of the provisions. So I went through this fairly quickly because I did want to go over some of our key lessons learned in using the ACS data, which allowed us to conduct these analyses of commute modes on a nationwide scale. First, when using ACS data, it's important to consider which of the data sets are most appropriate. The 5-year estimates provide the most precision for the estimates themselves and are available for jurisdictions of all population sizes. However, they obviously offer less precision in terms of the exact time period covered. In our case, both of our analyses included a very wide range of population sizes, from 500 or fewer to several million people in some jurisdictions. And jurisdictions with populations under 20,000, the lowest threshold for the non-5-year ACS estimates, represented more than 40% of all the analytical samples. So for that reason, we had to use the 5-year estimates. It's also important to consider the appropriate geographic summary level for analyses, since the ACS data covers such a wide range of geographic levels, from the block group level up to the state and nationwide levels. So for example, this was a consideration in our municipal complete streets analysis, since when places can span counties, and we did want to control for county level policies in that analysis. So there we use the place within county summary level rather than just the place summary level due to that. It's important to note in this regard that the same jurisdiction can fall under multiple summary levels. And as I indicated before, that was a key issue that we worked with on the complete streets analyses, where we referred to the census of governments. For other analyses, we've also found TigerWeb to be helpful in understanding differences between jurisdictions and possible overlap. Finally, in linking data sets, it's important to make correct use of the relevant FIPS codes. For example, for our municipal complete streets analysis, policies were at the place level, but we were linking to ACS data at the place within county level. So we used state and place FIPS codes with a one-to-many merge. For all merges, it's important to make sure that the FIPS codes are recorded consistently and that any changes in FIPS codes over time are taken account of, which was an issue for a couple of jurisdictions in our zoning analysis. And finally, when looking up FIPS codes, there is ambiguity in place names. And this was an issue with the complete streets analysis, where we had a census of policies and had to look up FIPS codes. And there is another situation where TigerWeb is definitely helpful for resolving those ambiguities. So both of these analyses have been published, and links are provided in this next to last slide. And of course, for more information, please feel free to reach out to me directly or pose your questions right now, and I'll be happy to answer those. Thank you very much.
All right. Thank you, Julian. And just a reminder, please feel free to drop all of your questions in the Q&A, and we will come back to those at the end. Next up, we have Kelly Dwyer joining us from the Urban Institute, and she'll be taking us through CCDF eligibility in Wisconsin, statewide, and in substate areas, a microsimulation analysis. So please welcome Kelly.
Thanks, Dory. As she mentioned, my name is Kelly Dwyer, and I'm a research analyst in the Income and Benefits Policy Center at the Urban Institute. And today I'm going to be telling you about a recent analysis that my team did, where we estimated eligibility in Wisconsin's child care subsidy program, both statewide and in substate areas in 2018, using the ADIS microsimulation model. I'll begin by giving you a brief overview of the project, and then I'll tell you a little more about how we used the ADIS model to estimate eligibility and participation in the child care subsidy program. I'll tell you a little bit about how we mapped households using the ACS data, and leave you with some information on what we actually found about statewide and substate eligibility estimates. So the Wisconsin Department of Children and Families, which administers the state's child care subsidy program, wanted our help estimating the number of children and families eligible across the state and in specific substate areas in order for them to understand how to best use their resources. Factors that shape CCDF participation, including childcare availability and the cost of unsubsidized care, likely vary across the state. So a full understanding of the reach of the program requires us to first know who is even eligible to participate. So we knew that for this analysis, we would want to use the ACS to be able to provide the best most accurate state level and sub-state level estimates of eligibility for their subsidized childcare program. We chose the ACS primarily due to the large sample size and reliable state level estimates, and then knowing that we could get a multi-year data file that can produce reliable sub-state level estimates was also very important in our decision. I want to give you a little bit of background on the Child Care and Development Fund, which is the federal block grant program that provides funds to states to help them subsidize childcare for families with lower incomes. While the program is governed by federal legislation and regulations that set broad guidelines, states and territories really have the flexibility to set policies as they see best fitting the needs of the families in their state. And in the average month of 2018, about 1.3 million children and 800,000 families were served. As I mentioned, each state really has the flexibility to set its own policies. So in Wisconsin's child care subsidy program, they set their own rules, including letting children up to age 13 or age 18 enroll in the program if their parents are working, attending school, or enrolled in a training program, or in some cases, a parent can also be searching for a job and become eligible or remain eligible for subsidized childcare. And in 2018, there were 2 different income eligibility limits applied to families in the program. The first is for families who are initially applying for the program. They had to have income below 185% of the federal poverty guidelines, and families who are already enrolled and maybe reapplying after their initial spell of eligibility ended can have income up to 85% of the state median income. And so this will become more important later as I discuss the Addis microsimulation model. So for this analysis, we decided that we should use our analysis of transfers, taxes, and income security model, which is an ACS-based microsimulation model maintained by the Urban Institute. Using Addis, we're able to estimate eligibility and participation in major means-tested programs like SNAP, WIC, TANF, SSI, public and subsidized housing, LIHEAP, and of course, most important for this analysis, CCDF. We also include taxes and tax credits in our model so that we can look at various things like the earned income tax credit and the child tax credit. The model goes through the ACS data and applies really specific program rules at an individual and household level to determine if a family is eligible for a program. And then if it seems like the family or individual would participate in the program, we model them as participating. And if they participate, what level of benefits they would receive. And this is why it's so important for us to have really detailed policy rules and program rules like the ones I described for the CCDF program in Wisconsin. And you can find out more about all of the rules that we applied in the model for the child care program in Wisconsin in our full report, which I've linked at the end of the presentation. So for this analysis, we decided to use a 5-year data file that combined data from 2014 to 2018 in order to have a very large sample of children and families in Wisconsin to work with. As I mentioned before, this really allows us to work at the sub-state level, which was really important for the Wisconsin Department of Children and Families. So there are some adjustments made to the 5-year file before we get a hold of it, and then we also make some additional adjustments on our end, like imputing the legal status of non-citizens, as well as whether cohabitating partners are both parents of a child in a household, and both of these affect CCDF eligibility. We also allocate annual income and weeks of work across months in the year and allocate other income as reported in the ACS into a couple of different income buckets, including unemployment, which is not reported separately in the ACS, and child support, as both of these can affect eligibility in public assistance programs. As a side note, we also produced estimates for the state using just the 2018 data file, and we were able to compare the state level estimates from the 5-year file and the 2018 file and got pretty similar results. So we felt like the 5-year data file was definitely a good fit for the state level analysis as well as the sub-state level analysis. We also were able to estimate eligibility in a few other programs for this project, including unemployment, SSI and TANF to adjust for various limitations in the ACS data and to improve the accuracy of our estimates. As I mentioned on the last slide, unemployment is not reported in the ACS data explicitly. It must be imputed, and unemployment receipt can affect TANF eligibility. And when we're modeling TANF eligibility, that can also affect CCDF eligibility, as families who receive TANF often have different eligibility requirements for the subsidized childcare program. It's also important for us to model SSI eligibility and receipt, because although SSI is reported as a separate income type in the ACS data, we have to impute whether children are receiving it, because as I mentioned, only children over age 13 who are eligible for the childcare subsidy program if they have special needs. A final refinement that we make to our estimates is to actually model participation in the CCDF program. And this is because, as I mentioned before, families who are already participating in the program are subject to a higher income eligibility limit. And if we were excluding those families from our eligibility estimates, we would be underestimating the total number of families who are eligible across the state. And that wouldn't be able to provide Wisconsin with the full picture of who is eligible and maybe already participating in the program in their state. So the Wisconsin Department of Children and Families actually administers programs at the sub-state level in groups called income maintenance consortiums and urban zones. They are organized by county, and sometimes these groups only serve a smaller geographic area, like a city like Milwaukee. And sometimes these groupings serve a larger geographic area that covers multiple counties, like the Northern or Great Rivers areas, which are shown on the upper left-hand corner of this map. Obviously, the ACS does not report what income maintenance consortium or urban zone a family in Wisconsin lives in. And they don't even report county level identifiers for privacy reasons. So we needed to work with one of the geographic identifiers that is available in the ACS data in order to figure out where families lived in the state. So we decided to use the public use microdata areas, or PUMAs, and use those to map families onto specific counties and then onto income maintenance consortiums. There were cases, and this was great, when the entire PUMA mapped onto a single county, like the PUMAs that surround the Milwaukee area, which is circled here in green. And so when that happened, we were able to assign all of the households in that PUMA to that county's income maintenance consortium or urban zone. However, when this did not happen, like in the Great Rivers or Northern area consortiums, we had to randomly assign households with children to a consortium based on the actual share of the Wisconsin child population that fell into that area. And to do this, we used the child population estimates from the Wisconsin Interactive Statistics on Health Population Model. So just to give you an example, we can see in the PUMA shown here on the right that it contains both Burnett County, which is in the Great Rivers area, and then it also contains Taylor County, which is in the northern region. So we had to make sure that we were allocating the correct number of families to the correct area. And we came pretty close to our target distributions, within 1% in most areas. And while this is the method that we decided to use, I will note that it does not account for variations in economic or demographic characteristics across a PUMA or area. So if there's significant variation in either of these two categories, the eligibility estimates might be slightly off for those groups. So one of the great things about the ADIS model is that we're not only able to see how many children or families might be eligible for a subsidy, but also break down those numbers by characteristics to give us a better understanding of need across the state. So in the average month, we found that about 175,000 children and 100,000 families were eligible for subsidies in Wisconsin statewide. We can see that the majority of these children, 55%, were school age. The second largest group of children were non-school age, followed by children ages 13 and over. And you'll notice that the share of children age 13 and over seems rather small in comparison to the other age groups. And this is because ADIS normally underestimates the number of children who would fall into this age group because, as I mentioned earlier, we have to rely on the imputation of receipt of SSI. We also found that about 61% of the eligible children were white or Asian and non-Hispanic, 20% were Black and non-Hispanic, and about 19% were Hispanic. We also found that about 61% of the children who were eligible for CCDF subsidies in the average month had family incomes between 100 and 200% of the federal poverty guidelines, but still nearly over a third of the children who were eligible in the average month had family income below 100% of the federal poverty guidelines. We also found that the vast majority of children, 72%, lived in households with one parent or guardian. We also found that the vast majority of children were living in households where the parent or parents were working full-time, which we defined as working 35 hours or more per week. And only 2% were in families where a parent was a student, and 1% were in families where a parent was searching for a job. Turning to the sub-state level estimates, using the methods we described earlier, we were able to determine that eligibility for each income maintenance consortium or urban zone ranged from about 900 eligible children in the southern rural area, which was less than 1% of the eligible children in the state, to a little over 50,000 eligible children in Milwaukee, which is about 29% of the eligible children. And this table only shows the 3 largest income maintenance consortiums and the smallest, and you can find the full information on all of the others in the full report. We were also able to estimate the eligible children as a share of the total population in each area. And we are defining the child population as all children under age 13 or children age 13 and older who are receiving SSI. The share ranged from about 7% in the Moraine Lakes urban area, which is not shown on this slide, to 30% in Milwaukee. Statewide, 19% of age eligible children were fully eligible for subsidies. And the number of families who were eligible in the sub-state areas ranged from about 500 in the Southern Rural Consortium to a little over 26,000 in Milwaukee. I wanted to note that the estimates provided here and in our report are our best estimates, and we also provide information on standard errors and information at the 95% confidence interval in our full report, as well as in the appendix slides of my presentation, which you can access later. So just in summary, I wanted to leave you with an overview of my presentation. We can use the ADIS microsimulation model, which uses ACS data to estimate eligibility and model participation in major means tested public assistance programs. And using a 5-year data file and mapping PUMAs to counties, we were able to estimate statewide and sub-state area eligibility for childcare subsidies in Wisconsin. And we found that about 175,000 children and 100,000 families were eligible in the average month. The ADIS microsimulation model is funded by the Robert Wood Johnson Foundation, and the report that this presentation was based on is funded by the Wisconsin Department of Children and Families. And here's a link to the full report and my contact information if you have any questions.
Thank you, Kelly. And I will be dropping the links that Kelly provided into the chat as well. So if folks are interested, know that you can find them there. And so now, last but certainly not least, please welcome Dory Thrasher. And she'll be presenting to us her work on New York City's SNAP participation rate. So Dory, take it away.
Thanks, Kirby. Okay, let me go ahead and share this. Does that look all right?
Looks perfect.
Thank you. So hi, everybody. My name is Dory Thrasher. I'm a city research scientist at the New York City Department of Social Services. DSS is one of the largest social services agencies in the country. We estimate that we serve about 3 million people a year across all of our programs. Today, I'm going to talk about our SNAP participation rate, which is actually very similar to the kind of what Kelly was talking about, but we try to estimate the number of eligible New Yorkers who the number of eligible New Yorkers who get benefits through the Supplemental Nutrition Assistance Program. And before I begin, I do want to acknowledge the contributions of my colleague, Erica Mullen, who developed much of this methodology, but isn't available to be here today. Okay, so New York City has about 8.5 million people, or sorry, it's 8.3 million people, and about 1.5 get SNAP every month. do want to mention that these are 2019 ACS data, and COVID has really affected the population of New York City, particularly the population living in poverty and those needing and accessing public assistance. So it's a really weird time to be using 2019 data to make any claims about our population, given all the challenges of 2020, which is something that I'm sure that everyone here is confronting as they use ACS for their research. But in any case, that number, 1.5 million SNAP recipients, is about 18% of the New York City population. But we don't know if that's like the right number of people getting SNAP or how far our program actually reaches. So one really simple check we do is called the Participation Program Access Index, which is really just the number of people who get SNAP divided by the number of New Yorkers who have incomes less than 125% of the federal poverty line. We do this mostly because the USDA does this. They calculate it nationally and state by state, although they haven't done it for 2018 or 2019 yet. But and it's a really, really rough number because it doesn't, that cutoff of 125% of the federal poverty line doesn't account for actual SNAP eligibility rules, which are a lot more complex. And I will talk about them later. But we can do this math to see that over time, the participation or the program access index has been increasing. It was 91% for 2019. And that's mostly because though the SNAP caseload has dropped since a post-recession high of about 1.8 million, the number of people in poverty has fallen even faster. But for a lot of the work that we do at DSS, we want a better understanding of how far SNAP reaches. We want to know who is missed. So I just include these images, which are part of our SNAP outreach for specific targeted populations. So the LGBTQ community, CUNY, college students, and seniors, who are three groups that we think could be even more better served by SNAP. So to get that more nuanced understanding, we calculate a participation rate, which uses ACS data to estimate the SNAP eligible population to construct a better denominator for the same calculation, right? The number of SNAP recipients divided by an actual eligible population, not just the rough federal poverty line cutoff. So I'll take a moment to talk about SNAP eligibility for a moment. So SNAP eligibility is really complicated, but it is mostly an interaction between income, age, the number of people in your household, but we actually mean a SNAP unit, which are people who share and eat food, share food and eat meals together. So the income cutoff is actually 130% of the federal poverty line. But if your family has earned income, that is somebody who works, it's 150%. Any household that is only people over 60 or people with disabilities, the cutoff is actually 200% of the federal poverty line. And immigration status plays into it. Only citizens, legal permanent residents who've been in status for 5 years, refugees, asylees, and LPRs with military connections are eligible for SNAP. College students in particular have their own SNAP eligibility rules. They have to work 20 hours a week or have a federal work-study placement or have very small children to qualify for SNAP. And then of course there are categorical eligibility categories. Anybody who gets, seniors who get SSI and cash assistance recipients are categorically eligible for SNAP. Okay, so now I'm going to go through like step by step how we calculate the denominator for the SNAP participation rate using our ACS data. Basically, we remove ineligible people from the data and then we count the eligible out of the remainder. It kind of looks like this. So we start with the total New York City population, excluding group quarters, because poverty is not calculated for people who live in group quarters, which gets us 8.1 million people. And then we do a couple of steps to remove ineligible immigrants. So we take out of our data set all adult non-citizens who have arrived within 5 years, and then we estimate the number of undocumented adults and temporary non-immigrant adults. And temporary non-immigrants are people who student visas, visiting academics, those sorts of categories of non-immigrant people who are non-citizens in the country for some reason or another. And then from all of those immigrants that we removed, we have to estimate the number of legal permanent residents with less than 5 years in the US who are eligible because of a military connection or refugee status, and then we add them back into our data set. And that gives us 7.4 million individuals. And of these, we then count those who live in households where everyone gets SSI, 121,000. We count the number of people who get SSI are over 60 or 60 or over and have a gross income of under 200% of the federal poverty line, another 879,000. We count the number of people who get SSI, are 60 or over, have a gross income of more than 200% of the federal poverty line, but they do meet our net income and asset tests, which is about 27,000. And then we count the working adults and children who do not get SSI, who have family incomes of 150% of poverty for those who work and 130% for those who do not work, which is another about 1 million people in New York. And then we just add up all those red numbers for about 2,042,435. And then we do that same calculation. The number average monthly SNAP recipients, 1.5 million divided by our total estimated SNAP eligible New Yorkers, 2,482,000, and come up with what we call our SNAP participation rate of 74.7%. I do want to stress, and the rest of the presentation is going to be all the reasons that our SNAP participation rate, though it is very precise to the decimal point, is really just an estimate for a lot of reasons, some to do with what is and isn't in the ACS, and some about how we calculate eligibility. So first, census households include all people in a residential unit, but SNAP units are only people who share food and meals. So unrelated roommates, for example, do not necessarily count as, would not necessarily count as a SNAP unit. Our use of this, we use the census households to determine a household, and that probably undercounts the denominator because it's going to exclude SNAP units that live in larger households and might be SNAP eligible on their own, but ineligible when the income of all the household members are considered. So you imagine like two families living together where each on their own would qualify for SNAP, but as a combined household, they don't. Further, the American Community Survey reports income over the past 12 months, but SNAP eligibility is income at the time of application. We actually don't care how much money you made in the past. We only care about your present situation. So we are probably undercounting the denominator because there are people who would be eligible if they applied now, even though the ACS would make it look like they're not eligible. And not all elements of the participation rate are available in the ACS data. For example, the non-citizen identifier really only distinguishes between citizens and non-citizens. It doesn't tell us anything about who has a green card, who's a temporary visitor. It definitely doesn't estimate undocumented individuals. So to do that, we actually work very closely with partners at the New York City Mayor's Office for Economic Opportunity and the Mayor's Office for Immigrant Affairs, who do a lot of work to estimate various immigrant categories of people in New York. So this graph at the right is from the Mayor's Office of Immigrant Affairs State of Our Immigrant City 2019 report, which is also based on ACS data. It's the 2018 data. And they go through a lot of their own processes to come up with these categories where they estimate how many people are naturalized, or how many people are green card holders, undocumented immigrants, and other categories. And so they share those numbers with us, and we use them in the SNAP participation rate. We've used different sources, especially to estimate undocumented immigrants in the past. But no matter where we pull that data from, they're all based on ACS data at root, sometimes augmented with information from other sources. And then also when we identify permanent residents with fewer than 5 years, that's quite inexact. The ACS gives the year of entry into the US, but it doesn't give the month, so we're not sure. And we also don't know how people actually answer that question. We need to know for SNAP that people have been legal permanent residents for 5 years, not that they've just been in the US for 5 years. So that is a sort of imprecise way of measuring that. Also, SSI receipt is taken from the New York Community Survey, and research shows that it is underreported along with almost all government benefits. And then we get really into the weeds with some of these. We applied the shelter deduction to everyone, which might overcount the denominator, artificially reducing the income of people who actually don't have shelter expenses. We don't estimate medical expenses or child support payments, which probably undercounts the denominator because people have lower incomes once those expenses are deducted or would be deducted. And we don't estimate college students who are ineligible because of the work requirement, because we just have not figured out how to do that. So I also want to say that we're not the only people who try to estimate a SNAP participation rate. The USDA does this as well. Actually, Mathematica does it for them. But they calculate a national estimate and break it out by state, and it doesn't count for state-specific rules. And New York State is a little more expansive in who is eligible than the national rules. The USDA takes a really different approach than we do as well. They use a lot of data sources, CPS, USDA SNAP data, IRS return data, the Survey of Income and Program Participation. So even though they're sort of trying to do the same thing, we can't compare rates. They also only produce a state level rate, and their 2017 participation rate for New York State was 93%, which is quite a far bit higher than the 74.7% that we estimate. Despite all these caveats, we do think that the SNAP participation rate estimate provides really valuable insight into trends year over year. Again, just like the number of SNAP recipients, the participation rate shows this post-recession bump where it was up to 77% in 2013, and then drops again and is up to 74.7 for 2019. We are very curious to find out what changed in 2020. So I'm really looking forward to running these analyses again when the 2020 data is available. We also break the participation rate down by age categories, and this is as granular as we get. We don't do it by borough or by race or any of those other things that we could, we can't, because we just actually don't trust that the estimation process is valid at smaller subgroups. So you see here that our senior rate, or the children, are our highest participants at 82%, seniors at 76%, which is very, very close to the citywide average, and our non-elderly or working age adults is 68%. Our senior rate is much, much higher than national estimates from the USDA suggest. They estimated the senior rate at 48% nationally for 2017. This is probably because New York City does a ton of work and to enroll seniors and do outreach to seniors. We also have an auto enrollment program, so seniors who get SSI are automatically enrolled in SNAP at the minimum benefit level until they provide documentation showing that they are eligible for a higher benefit. But still, that really, if we're just looking at the number of people enrolled, that it influences our participation. And New York City Council is very invested in having seniors be well served by our SNAP program. Local Law 134 requires us to estimate a participation rate for seniors and report it to council yearly. And then sort of, I guess we'll also say that we can use these numbers as a benchmark when we look at other populations. As I mentioned, we have specific outreach programs for seniors, for college students, and there was that great Pride LGBTQ outreach campaign. And so it provides just a benchmark. So when we're looking at, I'm also working on a project about public housing residents. So when we are able to know what our citywide participation rate is, it gives us a way to like compare how we're doing at these specific outreach target groups. And then the last thing I'll say about this is that calculating this, although we have our standard process, which we run every year, it changes year to year because of policy changes. In 2016, for example, that's when New York State changed eligibility from 130% of federal poverty to 150% for working families. And they made that change midway through the year. So our eligibility was not standard or consistent across the whole year. We had to figure out how to add that in and how to triangulate between the first part of the year and the second part of the year with the ACS data. And another policy change that may or may not affect our participation rate, but is that the college work rules are actually currently waived. There's like a temporary COVID waiver of college student work rules. And so because we don't actually factor student eligibility into our model, it probably isn't going to affect our participation or our denominator, but hopefully we'll have more students participate and our participation rate will go up. So yeah, that is my presentation. I'm very happy to take questions and talk about this. Thank you all. It's been great.
Thank you, Dory. And we have a few questions that came in. The first one for Dory is, can you say more about how you estimate undocumented adults?
I can only say that our numbers come from our very close partners at the Mayor's Office of Immigrant Affairs and the New York City Center for Economic Opportunity, which they've been really interested in understanding. So the New York City Office of Economic Opportunity calculates its own poverty measure. So it's similar to the supplemental poverty measure, but it is specific to New York. And they've been really interested in the way that immigrants may have different poverty or do have different poverty rates than the general population. So they spend a lot more effort trying to put together their undocumented immigrant estimation rates. You should Google their reports. That State of Our Immigrant City is one, and the immigrant poverty measure. I'm not sure the names of the reports, I'm sorry, but they are available through the Mayor's Office of Immigrant Affairs and the Office of Economic Opportunity. And they'll probably talk a little bit more about their methodology. We are very lucky that they do that work for us, so we don't have to.
All right, thank you. And have another question for you as well. This question is asking whether the number of SNAP users that you have from HHS data is the same or within the margin of error of the ACS SNAP data table.
Oh, I am so glad this question got asked because I spent the morning thinking about this one. I was like, oh, someone is going to ask this. I need to get close to a good answer. We don't pay much mind to the SNAP estimates in ACS. We think they're drastically underreported, and that is based on our own analysis of just because SNAP recipients are measured at the household level in ACS, and just the number of people or the number of households reporting SNAP benefits is just like far fewer than the number of SNAP cases that we see. So that's part A. And then there has been sort of external research that linked directly SNAP data to ACS using the PIK, and just found that there were almost half of families that got SNAP didn't report it in the ACS. So we don't use it. We don't really pay attention to it or think about it. I did look it up this morning, and it does look like the overall number in the 2019 ACS is about our monthly number, but and this is complicated by the fact that we do not produce an unduplicated yearly number because it's really hard for lots of reasons. But our unduplicated yearly number is going to be much, much higher than any individual month. So that's the answer to that.
Perfect. Thank you.
Thank you.
So I'm checking, seeing no other questions. If you have a burning question that you'd like one of our panelists to answer, please drop it in now. I'm checking the Q&A in the chat. With that, I would like to extend my thanks to all of our panelists today for their wonderful presentations. They had a lot of information that they covered. Again, you should be able to find all of their information in the attendee hub for you to reach out with any additional questions, thoughts, comments, etc. So thank you all, and please enjoy the rest of the conference. Thanks for joining us today.
Thank you.